It is totally normal to feel a little worried when your child develops a fever, especially after vaccinations. You want to make sure you are doing everything right to keep them safe and comfortable. Understanding when a post-vaccine fever is just a typical immune response versus when it signals something more is incredibly empowering for any parent, providing clarity during a potentially anxious time. Generally, you should call your doctor for a child vaccine fever if your baby is under 3 months old and has a rectal temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher. For older children, you should call if the fever is 104 degrees Fahrenheit or 40 degrees Celsius or higher. If it lasts longer than 24 to 48 hours, or if your child appears very ill or has other concerning symptoms like extreme lethargy or difficulty breathing. Fevers after vaccinations are a normal and expected sign that your child's immune system is actively building crucial protection. When the vaccine is given, it introduces a small, harmless part of a virus or bacteria, safely teaching the body how to recognize and fight future infections. This learning process often triggers a temporary inflammatory response, which can result in a low-grade fever, fussiness, or soreness at the injection site. The specific temperature, thresholds, and duration that warrant a call are carefully considered because they help distinguish between a typical, self-limiting immune training response and a situation where further medical evaluation might be beneficial, especially important for very young infants whose immune systems are still quite fragile. To know when to contact your pediatrician, your first step should always be to take an accurate temperature reading. For infants and young toddlers, a rectal thermometer provides the most reliable result. If your child is 3 months old or younger and has a rectal temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher, it is important to call your doctor immediately. For children older than 3 months, you should reach out to your healthcare provider if their fever reaches 104 degrees Fahrenheit or 40 degrees Celsius. Additionally, if a lower fever persists for more than 24 to 48 hours, or if your child shows signs of significant discomfort or illness, a call is warranted. Beyond the temperature number, pay close attention to how your child is acting. Look for concerning changes in behavior such as unusual lethargy or drowsiness, extreme fussiness that cannot be comforted, refusing to eat or drink adequate fluids, producing significantly fewer wet diapers, difficulty breathing, a new rash, or if they simply do not seem right to you. These accompanying symptoms are just as important as the temperature reading itself. You can also offer an age-appropriate dose of acetaminophen or ibuprofen to help manage their discomfort, always confirming the correct dosage with your doctor or pharmacist beforehand. A particularly helpful detail for parents is to also observe your child's overall demeanor and hydration status. Are they still making a contact, even if they are a little more subdued? Are they interested in playing, even briefly? Are they accepting fluids, either from breastfeeding a bottle or a cup, and are they wetting diapers regularly? These subtle cues, alongside the temperature, offer a more complete picture of your child's condition. For example, a child with a moderately high fever who is still responsive, playful, and well hydrated is often less concerning than a child with a lower fever who is extremely lethargic, difficult to wake, or showing signs of dehydration. Keeping a simple log of temperature readings, medication times, and any new symptoms can also be incredibly helpful information to share with your doctor. Keeping a close eye on your child after vaccinations, understanding these clear guidelines, and knowing exactly when to seek professional advice provides invaluable peace of mind for you as a parent. It empowers you to confidently support your child through this important health milestone, ensuring their safety and comfort while their immune system grows stronger and more resilient. Trusting your parental instincts and having a clear plan for when to act decisively are among the most important tools you have for your child's well-being.